Thank you so much for joining us. It's been a while since we did a live as we were really busy recruiting and then conducting our studies. So many of us are searching for answers about hormone replacement therapy, HRT, and want clarity in this confusing landscape. HRT is often used to help manage symptoms related to hormone imbalances, such as those from menopause or certain health conditions. Navigating personal health can be overwhelming, and every journey looks a little different. Sometimes it's hard to know what questions to ask or what signs to look for. And some common concerns include having labs checked, getting treatments that are tailored to individual needs, and discussing family history. Unfortunately, we don't have many resources that can help us to get those answers. That's why we're so glad to chat on IG Live today with Nicole Stroop, a nurse practitioner and a certified functional medicine specialist. So during this live, we are going to discuss HRT red flags when working with a physician, the role of genetics in HRT, what to look for in labs, and so much more. Hi, Nicole.
Hi, how are you doing?
Good, good. How are you?
I'm doing well. Thank you so much for having me today. I'm really looking forward to chatting about this.
Oh, thank you so much for taking the time. I think this is the first time we're covering HRT. And I'm myself wanting to know so much more about this. So, before we start, tell us a little bit about yourself, like how you became a nurse practitioner and a certified functional medicine specialist.
Yeah, absolutely. I have my Master of Science in Nursing as a family nurse practitioner, and I actually worked in orthopedic surgery for a while, but due to commonalities I was seeing with my patients as well as my personal medical issues, I just felt really unsatisfied. I felt like there was more to medicine that I just didn't have access to, wasn't aware of, wanted to learn more. So I went back to the Institute for Functional Medicine, and that's where I got certified in functional medicine. And then I also went to the American Academy for Anti-Aging Medicine, which is where I studied peptide therapy, bioidentical hormone replacement therapy, and then I've taken multiple advanced courses on stem cell therapy for my regenerative medicine position. So since then, I've been practicing in both family and functional medicine and absolutely love what I do.
Wow. Okay, today we're only going to cover HRT, but I feel like, okay, we need to get you back on, like, talk about longevity medicine and all
Oh,
really advanced therapy that, not a lot of people are actually aware of that could be really useful for their longevity or just optimizing health.
Oh, yeah, absolutely, for sure. But yes, today's about HRT. But yeah, anytime we want to talk about longevity, also a favorite topic of mine.
Awesome. You are great at giving really practical advices to your clients. So what's this 80/20 methods and why are you such a fan of it?
So the 80/20 method is just kind of a way of living. And I break it down 80% of the time, I'm doing the best that I can do. 20% of the time, life is just absolutely happening. And I feel like that's relatable for a lot of people.
Mhm.
I think a lot of my clients come in to see me, especially if they don't know me, and they're under the impression that it's all or nothing, that you have to be completely non-toxic or you have to be perfect 100% of the time or that means failure. And I just don't love that mindset because I personally don't live like that, nor do I want other people to feel that way. I feel like when you have that mindset, you are more likely to fail because you're going to be like this, well, this is it. Like I've messed up, so I might as well just give up. That's the mentality a lot of people have. So it's just really understanding that realistic living means do the best that you can, but also life's happening. And anyone who tells you that that's not a realistic part of it, it's probably lying. So that's how I choose to live and how I choose to preach that to others.
I love it. I love it. And I also love my cheat days. I have that 20 like my cheat days. I love it.
Oh, yeah. I get patients all the time that they're like, it's my birthday or my honeymoon. Like, can I do this? Can I eat this? And I'm like, yes, absolutely. Like, this is like, live your life, like, have a good time. And then, next week you just reset and you do a little bit better, but enjoy the moments. Like, that is what life is about. That makes it worthwhile.
Cool. So today about HRT. So a lot of time it's like HRT has its red flags. And And then this live is, based on this really thought-provoking post that you shared in your feed. But first foremost, like why did you think this post was so much needed? HRT red flags.
Yeah, that's a great question. So, a lot of patients that I get who are interested in hormone replacement therapy already have some experience with hormone replacement therapy. And just being completely honest, sometimes the types of medications or hormone replacements that I see my patients on, or the way that their care has been managed, is frankly pretty alarming. And, it's definitely not the patient's fault. They don't know better. So part of me wanting to make a post like that was to share that information to let people know, hey, this is acceptable or not acceptable, and this is what you should be looking for out of HRT with your provider.
What would you consider as a red flag, like especially when it comes to medicine?
Yeah. I think the biggest one in medicine in general, but also HRT, is I get a lot of patients who have never had their labs checked, even on the forefront. And also, they've been started on HRT and they've still never been checked. And they frequently say things like, well, my provider said my hormones always changing, so it doesn't matter. Or they're just totally going off my symptoms, which definitely matters. Like, symptoms are very, very important, but I don't know what's going on in the body by just looking at you. Like, I don't know how you're breaking down your hormones or if you are metabolizing them properly or if your ratios are proper. Not every person needs the same amount of HRT. We are all very individualized in that sense. And so the ability to see on paper what's happening so you can correlate with someone's symptoms is very, very valuable. The other thing I frequently see, and this is just across the board, is estrogen being given alone without progesterone as its opposition. Estrogen dominance is something I talk a lot about, especially in premenopausal women, but even postmenopausal. Like, if estrogen's running rampant and there is nothing to counteract it, like we are dramatically increasing our risk of estrogen driven cancers, and that's certainly not what anybody wants. So,
Mm. So from what you perfectly said, so from what you said, okay, you definitely want to check your labs before you even begin HRT. Why you need to know like where you're at, so and then also establish some baselines. As we fluctuate, you kind of also want to check like why you're getting HRT, so then you can make adjustments and stuff, right?
absolutely.
And then like, okay, when it comes to dosage, I guess this is also related to checking the labs and everything. Does everyone need the same dose?
Definitely not. And HRT also comes in multiple forms. And so different forms are appropriate or better for different people, same as dosage. Some people only require a small amount, some people require a lot more. And I think a take home message for sure is that, especially as it relates to testosterone in men or women, testosterone does not just stay as testosterone in the body, it breaks down into other things. And again, just another reason to look at it because I don't know what's happening, inside your body. And frankly, like, no matter how good you are as a provider, none of us know that. Like, we don't have x ray vision. Unfortunately, that is not something taught us in nurse practitioner school. So,
While you're on testosterone, we literally had a question came in. What about when the person has very low testosterone and willpower? I feel like it's much harder to reset the next week after having that cheat meal. It takes a lot to get on track.
yeah, I wonder if, oh, let me read it again. So, I guess maybe to go back to that person, I don't know that I'm totally understanding the question because it does feel like the topics are kind of two separate things.
Yeah, it was
Yeah, two separate things. It's just, low testosterone, I think like there's a lot of different reasons that can happen. Especially if you're younger, if you're a man, lots of things to rule out, whether it's lifestyle, you think alcohol, cigarette smoking, metabolic syndrome, if you're overweight or have excess adipose tissue in your stomach. You look at toxins and things of that nature. Women frequently see this in our 30s, rapid decline. Lots of it has to do with stress. A lot of this is very common in the postpartum window. So kind of figuring out why that's happening is the best way to address that. And then the other topic, I guess, the
Reset.
willpower. Yeah, the will, how to get back after the willpower. I think for a lot of people, thinking of it as a cheat meal is kind of where the downfall is. Instead of thinking of it like, oh, I'm doing this bad thing, puts almost like a negative connotation behind it, and it makes it harder to
Mhm.
reset. Which is again why I'm a little bit more 80/20. Like, even if you want to do that on a daily basis, maybe 80% of your day is good, but 20% of your day is that little, like, whatever makes you happy, like whatever you need at the end of the day. And maybe you choose to live a little bit more like that versus like 6 days out of the week, you're super stringent. And then Sunday, you just go wild. That might make it a little easier and provide more balance.
I will from this point on correct my terminology. So I do agree the cheat using cheat is a bit of like got that negative connotation, but if we do 80/20, I love it.
Yeah, yeah, absolutely. I think a lot of people struggle with that. Just it's a mindset. And certainly if you're someone who has that association, like this is my one time that I'm able to cheat, definitely makes it harder to feel like,
Mm.
oh, okay, tomorrow I have chicken and broccoli. So excited.
Yeah. So you were mentioning estrogen and progesterone. So why is it a red flag to get estrogen without the progesterone?
Yeah, so estrogen definitely needs its counterpart. Progesterone is important to basically create a healthy ratio between the two, which is one of the major ways that helps our body kind of metabolize estrogen and create hormonal balance as a whole. When we have really high estrogen and not enough progesterone, our estrogen is generally more likely to not only metabolize poorly, but also kind of run rampant is the best layman's terms. So having that opposition is definitely something that is very valuable, especially in people who have a personal or family history of estrogen driven cancers.
Right. Oh, actually, now on family history, I realized I forgot to ask you one other question. Uh, Things to consider when you're getting HRT is like what role does family history play in their treatment?
Yeah, absolutely. I think it depends. And this is, this may vary a little bit provider to provider. I personally will not start someone on estrogen therapy of any kind, synthetic, bioidentical. I only use bioidentical, but none. If they have a personal history of estrogen driven cancer. That's just me. To me, it's not worth the risk. There are other things out there that you can use. Maca is really popular. Black cohosh is another that can help mitigate estrogen-driven symptoms without actually giving you estrogen. If it's family history, then there's a few kind of questions to follow. What's the family history? What are we really looking at? Have you been tested for the genes? Have you done a Dutch test, which shows us how you break down and metabolize estrogen? And maybe they haven't done all of that. Maybe they don't want to do that, and that's okay too. I usually will just prefer to give them, if they still choose to proceed, understanding any risks that are associated, choose to do patches of estrogen versus oral estrogen. Oral estrogen has the first pass liver effect, which is really where the risk raises. Transdermal is generally associated with less risks for estrogen driven cancer as a whole.
Wow, so useful. Um, you mentioned you only use bioidentical hormones for HRT. So what are the difference between the synthetic versus the bioidentical ones?
Yeah. So, kind of as it sounds, synthetic is exactly that. It's not natural. Our body does not recognize it as that. They contain molecules that are basically not identical to our estrogen molecules, whereas bioidentical more similarly relates to that. As it pertains to the body, we basically have two major estrogen receptors. We have an alpha receptor and we have a beta receptor. When you're taking synthetic estrogen, instead of it matching perfectly to our receptors, it mismatches a little bit. That's why our body recognizes it as foreign, and it's more prone to go towards that alpha receptor. And that alpha receptor is something that very commonly stimulates things like cell growth and proliferation. So when you talk about like cancer driven processes, Whereas your bioidentical hormone replacement therapy acts on both, and your beta receptor is more protective. It's anti-proliferative. It's more cell protective. And so you're just getting an overstimulation of not only that bad receptor, but you're also mismatching on that receptor as a whole, so your body's more likely to recognize it as foreign.
That everyone should be using bioidentical hormones rather than the synthetic. Why are we still getting that? Is it because it's like cheap, and then just physicians are not aware?
That's a great question. Cost-wise, I think it depends. There's lots of variables in that, so possibly. Just being honest, like I didn't get a lot of hormone replacement therapy training when I was in nurse practitioner school. And certainly I think a lot of women can relate to this. We have been heavily trained in the usage of birth control and birth control like substances. Yeah. And I think that's also what most providers are familiar with because that's the stuff that not only has been bred into us over years and years and years of lifestyle, but that's also the stuff that we definitely talk about the most in school. I am trying to think back, and I don't know that I ever really had a conversation about bioidentical versus synthetic hormones. And I'm not even sure that I ever knew there was a huge difference until I got to functional medicine school. And so I think training is part of it. And just ease. It's convenient to just be like, oh, here, just take this birth control. A lot of times, when we're talking about quality bioidentical hormone replacement, oftentimes it has to be compounded at a compound pharmacy. And, in conventional medicine, you're dealing with maybe 10-minute appointments, lots and lots and lots of patients, lots of demands, lots of needs, and you don't necessarily have time for that personal touch as much as you do in a field where, we're not insurance driven. So,
That makes so much sense. But then if you think about it, like if this have like a way better health outcome, which we're talking about hormone-driven cancers, like that's gonna cost you so much more money and so much more time. Why
yeah.
wouldn't you do a better version, start from the
Exactly.
better source?
Oh, yeah. I mean, you talk about the lifelong risks. I mean, in my opinion, I've made a lot of videos about this. I was on birth control for a really long time, so I'm particularly passionate about it. But I really don't think it's something that, if you can avoid it, you really should. And a lot of providers will use it almost as a transition in the perimenopausal window. They'll just say, here, just take this birth control. You'll just slide through perimenopause like it's nothing. Which is wild to me. Like your body is going through such change. It has, you're losing testosterone, then progesterone, then your estrogen's going wild. You have all these symptoms. So it just always shocks me when the solution is let's just shut everything off so nothing's happening versus why don't we support this process so you feel really, really good?
Makes so much sense. Why would a body have trouble metabolizing estrogen?
So a lot of it has to do with genetics. Genetically, there are certain pathways that help us break down estrogen. And even further past that, as it pertains to our liver, a lot of it has to do also with nutrients and antioxidant protection. There's a few main ways that we get rid of estrogen. Glutathione, like glutathione peroxidation is a big one when we talk about our ability to adequately detox it. But even a step back before that, we have a couple major genes. Our COMT gene is huge for this, allowing us to get rid of extra estrogen. Um, in our younger crowds, sometimes too, we will also see backup with stool. I see a lot of patients with constipation, which is a huge way that we get rid of bad estrogen. We have a particular enzyme known as beta glucuronidase that binds to extra estrogen that allows us to excrete it through our stool. So if you're constipated, you are holding on to extra estrogen for anyone who is listening. But also, you will see it with women who maybe you've lived in a state of estrogen dominance for a long time, like maybe you're someone who has endometriosis, for example.
Mhm.
Endometriosis lesions secrete extra estrogen. So, talk about a vicious cycle of trying to get your estrogen under control when you're battling like constant extra estrogen production simultaneously. So, there's a few reasons genetics, liver, stool, things of that nature.
It's definitely like a really complicated topic. So it's better to really work with someone who knows what they're doing. So my next question is, how can someone work with you?
Oh yeah. So if you're interested in working with me, there is a link in my bio on my Instagram. It's down there at the bottom to book a wellness consult with me, or if you are only interested in hormone replacement therapy, there is a hormone replacement therapy consult. Because testosterone is a controlled substance, I do always let my patients know I am licensed in several states, so I do take out of state patients. However, I cannot ship testosterone across state lines. So pretty much my Tennessee folks are the primary ones who I can give testosterone to. But my out of state patients who I can't do that with, frequently I'll just guide their HRT, and they can get it locally instead. So I'm flexible. I try to just make myself as available as possible for, whatever the patient needs and is best for the patient.
Amazing. Anything else you'd like to share?
Anything else I'd like to share? Um, I think the only other thing as it relates to HRT that I just do want women to know is that it's not necessarily just for our postmenopausal women. I get a lot of women who are obviously premenopause, and I will frequently use hormone replacement therapy temporarily, like at a 3-month window, especially postpartum, to get hormones back on track. As long as it's 3 months or less, research does show that does not interfere with fertility. So yeah, I just want people to know that, it's not just our older individuals who are going through menopause that this pertains to. Like this is definitely, relevant to the younger crowd as well.
Especially when you can use bioidentical hormones rather than
Oh yeah.
synthetic.
Absolutely. I think it's great when you're able to do that work because then you can do the background work at the same time. Like, why is this happening? You get the patient feeling better with HRT, and then you do the background work on why it's happening. So then when they come off of it, it's just a nice, smooth, easy transition versus it taking, typically quite a bit longer and quite a bit more effort to do it without any extra assistance. So not always the case, but frequently when we need hormonal recovery, it's a very, very handy tool to have.
Also, postpartum, I think at least in Chinese medicine, Chinese culture, so I'm Chinese and I'm aware that we're always being told that, this postpartum period is like extremely important. And then that actually like can impact the rest of your life, including your menopause. So I could really see that, if you need to rebalance your hormone, this would be the really good time to do it. And then also make sure that you use bioidentical hormones.
Yeah, absolutely. And you actually brought up something really good that I think is also important to share that people shouldn't just necessarily consider hormone replacement therapy for symptoms, hot flashes, night sweats, low libido, things of that nature. As we age, and especially if you can start hormone replacement therapy within about 10 years of your transition, you're going to get a lot of extra long-term benefits. You'll get neuroprotection from testosterone. There is a huge link to low testosterone levels in people with like Alzheimer's and dementia. It's also cardiac protective. Estrogen is so bone protective. I mean, any of my healthcare friends who are on here, will definitely attest. You get an older woman with osteoporosis who takes the fall and fractures her hip, like that's a death sentence for a lot of women.
Yeah.
And so making sure that you are getting that adequate bone protection from estrogen is so valuable as we age. It's also an estrogen too is cardiac protective. So there's definitely a lot of benefits that come from being on HRT outside of just the symptom part of it.
So anyone who's listening, if you're considering it, make sure you book a wellness consult with Nicole and then go from there.
Yes, yes, absolutely.
Thank you so much for all your knowledge and thank you for what you do. We're gonna have to get you back on talk to more about testosterone longevity and all the like cutting edge therapies that we could be utilizing.
Oh yeah, absolutely. I would be happy to join anytime. Thank you again so much for having me. I really enjoyed talking about this. So
Have a good night.
yes, thank you. You too. Have a good one.
Bye.